This is about the problems that occur in the elbow and how a physiotherapist would assess it. We are Witty, Pask and Buckingham, Chartered Physiotherapists in Northampton. We have been the leading physiotherapy clinic in the region for 40 years. We treat bone, joint, muscle, tendon, ligament and nerve issues all over the body. Using manual and manipulative treatment techniques, shockwave and exercise regimes, we work to get you back to full health as quickly as possible. The four main areas that are problems in the elbow are the classic tennis elbow and golfer's elbow on the inside, but you can equally have problems within the joint itself, where the bicep tendon comes down over the front, and also where the olecranon fits into the joint and the triceps tendon attaches at the back. We'd also look at muscle strength and whether any pain is produced by stressing any of the tendons around the joint, and we'd look at that with both forearm, wrist flexion, extension. Often they stimulate around the tennis and golfer's elbows. We'd look at grip. Does that do it? Different angles of grip, different movements through there. We'd also look at the elbow itself in terms of you hold the arm there. Any issues with that? Different positions of supination, pronation as well, and different angles, all of which can provoke pain and help us assess. So palpation is very important around the elbow. We'd look on the outside towards the epicondyle, which is where the tendons from the forearm attach and how sore that is. You'd then come down into the tendon itself and then further down into the belly of the muscle, and also a careful palpation around the radial head, which is in here, as well as around the posterior part of the joint and the triceps tendon into there. We'd very carefully come down through biceps, down into where the biceps attaches down onto radius in here, carefully over this, what's called the bicipital aponeurosis, which is fibrous tissues across here, and around into the golfer's elbow area, as well as down into the forearm muscles from there. Whenever you're looking at the elbow, you would always look at the neck, you'd always look at range of movement through there, whether you've got any restrictions, particularly down through the base part of the neck where the nerves that are supplied down this area come from. You'd always look at first rib, second rib through here, where the nerves come through the shoulder, and you'd look at some very specific nerve tests as well. After taking a full history, we'd look at range of movement, we'd look at passive and active flexion and extension, pronation, supination, looking for any pain and discomfort as we go. There are many different treatment options in for example, tennis elbow. You need to work on that very specific soft tissue in here, which will be manual therapy, getting stuck into that. You might use some implements, you might use thumbs and fingers, you might use shockwave, you might use acupuncture through there. You'd also work down into the forearm muscles. You'd very much work on the nerve. You'd always look at the nerve when you're looking at a tennis elbow thing. You'd look up into the neck as well, particularly as all part of that system through there. And then you'd also work on strength through these areas with loading techniques, eccentric loading plus others, isometrics, that load that tendon to improve its ability to take load and transfer load. So there are many things as chartered physiotherapists that we can do in treating a tennis elbow or any other elbow issue. We can get it scanned if we need to, we can see what's going on, we can refer onwards for injections if they're particularly stubborn, but a good assessment is the place to start, so come and let us have a look at it.